we're likely to see a real distress among people in prison. We have some research that says 80% of people in prison already have mental health issues. They already have other underlying issues. So for COVID infections to occur on top of existing issues, we've heard a lot about that in the community being of great concern and people being at increased risk of death because of that. The other issue is the distress among families. Contact with families in person has been suspended, and rightly so, but the innovations using technologies haven't picked up. We knew that this was potentially an issue from early 2020, and we just haven't seen that injection of resources or minds to make the plans and, for example, to access technologies to really ensure that the community and families know what is going on in prisons.
While I've got you, there's been a lot of discussion about Indigenous health, and particularly in remote communities in parts of regional, rural New South Wales. What do you think, or what's your assessment of the rollout of COVID-19 vaccines and an information campaign around that?
Vaccine rates in New South Wales are reportedly around 80%, so high, and there has been some coordination more recently from Justice Health and Corrective Services New South Wales for information campaigns. But the issue is about access to healthcare. We've known since the Royal Commission into Aboriginal deaths in custody 30 years ago that Aboriginal and Torres Strait Islander community-controlled health organisations ought to be involved, and certainly because of United Nations and international and national guidelines have the right to be involved in the design and delivery of healthcare to people in prison. That gap is alarming, and that's alarming because for Aboriginal and Torres Strait Islander people in prison, there's already multiple and compounding issues, and those Aboriginal and Torres Strait Islander community-controlled health organisations have expertise in addressing those. On the other hand, with the mainstream health sector, we know that they don't have cultural safety plans, they don't have cultural competency training. We are very unsure about the extent to which that can influence service delivery that actually meets people's needs. And worse than that, we've got a New South Wales Inspectorate's own report to Parliament that prison health services were not able to meet need, and that was before the pandemic. So it's not just a matter of cultural care, but it's a matter of basic health care. And that's extremely challenging within prison circumstances with lockdowns, and imagine the pressure on the workforce as well. We know it's a workforce who are not necessarily highly trained in social care and health service delivery, and the additional pressures of the lockdown are reportedly increasing that punitivity and the distress that the workforce and people in prison are under, as well as families in the community. We haven't seen prison numbers decrease significantly because of the pandemic, and we haven't seen numbers of people on remand and unsentenced reduce necessarily. So we're not stopping the numbers of people going into prisons, and we are seeing outbreaks in prisons that are extremely hard to manage.
So, and what have you been hearing from in the ground in prisons? Because certainly we've had reports from here in the ACT about small outbreaks and just that sense of unsureness of what's happening next.
That's right. We haven't seen any coordinated plans. Aboriginal and Torres Strait Islander health services have a peak national body. In New South Wales, we have a peak state body. We haven't seen a task force put together. We haven't seen the type of planning that you would expect for prison populations with multiple health issues, and we haven't seen the input from the variety of experts that are needed, because this isn't just a prison issue, this is a public health issue, and it also requires responses from services from housing, from family support, as well as individual support. So we're not seeing enough support for individuals with health issues in prisons, let alone as they're transitioning out of prison and into the community.